Hey everyone, and welcome back to Breaking Down Nursing. In this video, we're going to cover IV fluids. So before we get started, a key concept to understand, tonicity describes how fluid affects water movement between the bloodstream and the body cells. Remember, water always moves toward higher solute concentration. This is also the definition of osmosis. This means that fluids can either keep fluids in the bloodstream, pull fluid out of the cells, or push fluid into the cells. So let's move on to isotonic fluids. Isotonic fluids have the same osmolarity as blood plasma, meaning if we were to take a cell and drop it into isotonic solutions, the water shift is equal. There's as much water shifting into the cell as shifting out of the cell, and the cell remains normal. This does not cause a fluid shift between the cells and the blood vessels because it's a net equal. Instead, they're primarily used to expand the intravascular volume. Some common isotonic fluids include things like normal saline, lactated ringers, and our common uses include things like dehydration, hypovolemia, shock, and fluid resuscitation. Moving on to hypotonic solutions. Hypotonic solutions have lower osmolarity than plasma. So if we were to drop a cell into a hypotonic solution, we would have more solute concentration inside of the cell than in the fluid itself, leading to the water shifting from the low concentration of the fluid into the cell to dilute that high concentration of fluid. Some common hypotonic fluids include things like 0.45% or half normal saline and D5W after metabolism. Some common uses are hypernatremia or cellular dehydration. But again, we must use these in caution because they can cause cerebral edema, and we need to closely monitor them when administering hypotonic solutions. Also, as an NCLEX tip, avoid hypotonic fluids in patients with increased intracranial pressure because it will only continue to increase with the cerebral swelling. Moving on to hypertonic fluids. Hypertonic fluids have higher osmolality than our plasma. If we drop our cell into a hypertonic solution, we have a higher concentration in the fluid than inside the cell. So our water would shift from inside the cell to into the hypertonic solution. It pulls the water out of the cells into the bloodstream, and that would then shrink the cell itself. Some common hypertonic fluids include things like 3% normal saline, D5NS, D5LR, and some of our common uses are severe hyponatremia and cerebral edema. And keep in mind, many hypertonic solutions require central line administration, but we must administer them carefully because they can also cause things like fluid overload and pulmonary edema. As always, thanks for watching, and click the subscribe button at the bottom for more tips and tricks. As always, take care and see you next time.